then okay, prioritizing hypotheses or figuring out where do I start. And I'm going to ask you a question. So let's say you are in the neuro ICU and you are getting a patient from the OR who just had a craniotomy. What is the number one complication that you're worried about and that you're thinking about? What would you prioritize? Let's assume, they're coming on the ventilator, so they have their airways intact. We're worried about a complication from craniotomy or any kind of head surgery, head trauma, and that's going to be an increase in ICP. And Joseph got it. Joseph R. got it. Increased ICP. Yes. And so in this next question, we are going to figure out what assessment do I want to prioritize in this plan of care for this client who's at risk for increased ICP. So these are all of these options here are part of a normal neuro assessment. I'm going to assess all of these things. But as far as what I prioritize is a different story. So the Babinski reflex, that's where you stroke the foot, right, and watch which direction the toes go. That is an important assessment, but it's also more related to a spinal cord problem, not a problem of increased ICP. So this is useful, but I'm not going to prioritize it. Then the presence of a headache. Well, would you have a headache with increased ICP? Yeah, I think you would, right? But wouldn't you also have a headache because you just had brain surgery? Yes. So if they have a headache, that doesn't really tell you necessarily that they have increased ICP. It just might tell you that they have had brain surgery, right? So this might not be as useful. We'll hang on to it. Then pupil size and reactivity. You guys have probably heard that the pupils are the windows into the brain, and that is true. You will see pupil changes when you have swelling in the brain and it compresses that optic nerve, but this is a late sign. It takes a really long time for pupil changes to develop, and by the time you're going to see a blown or fixed pupil, it might be too late to take them back to the OR and insert a drain. But this final one here is what most of you guessed, and you are correct. The LOC is going to be your earliest and most sensitive indicator of changes in ICP. So that's the first thing you're going to notice when your patient's ICP starts to go up. They're going to be less responsive, lethargic, drowsy. You might have to, give them a little sternal rub to wake them up. And so this is what you want to prioritize: going into the room, saying their name, making sure they can wake up and talk to you normally. So we are prioritizing that level of consciousness assessment. And well done. So this is a need to know, and I think most of you, almost everybody got this one right. But that is a need to know for the NCLEX. So don't miss this one. Level of consciousness is what you want to assess for changes in ICP.